Amanda, and today I'm going to talk about pharmaceutical regulations. So from personal experience and hands-on experience in pharmacies, I've noticed that they have many regulations that they need to follow regarding how they make their medication. So pharmaceutical companies have an amassed amount of laws and regulations dealing with guidance, compliance, and regulatory information when working with drugs. So the first thing I want to talk about or discuss is compounding. So compounding is basically the creation of a drug to meet the specific needs of an individual person. So when I worked at a pharmacy back in June, for example, this pharmacist gave me that, let's just say there was an autistic kid and he doesn't like a certain taste of a certain medication, he doesn't like the texture. What compounding pharmacies can do is they can change that texture, that flavor, the color of the medication, and the dosage. So according to Kate Trainer in her article, Compounding Pharmacy Oversight Moves Ahead, she states that the proposed legislation would bring compounding manufacturers under FDA's full inspectional oversight, require them to release all records requested by agency, and allow the FDA unfettered access to any facility under inspection. So that basically just states that it gives the FDA the rights to know basically what's going on in these compounding pharmacies, how they make the medications, and this and that. So there are many pharmacies that do compounding, but only a handful of them do sterile compounding, and sterile means free of all bacteria, microorganisms, and then a lot of compounding pharmacies also have their non-sterile lab, and this other lab where they focus on making hormone medications. So keeping on the topic of medications, my next thing that I want to talk about is generic medications. Generic medications are the same as brand name medications, except the big difference between them is that generic medications are a lot cheaper. That's the huge difference. As brand name medications, so generic medications have exactly the same, or it comes the same when it comes to the dosage, the amount, the effect, the route of transmission, so if you take it orally or not, and the quality of the medication. So dealing with generic medications, they're also under the law of the FDA to make sure that they meet the requirements of the brand name medication and to make sure that the generic medication is ready to go. Still talking about medications, the next thing I would like to discuss is prescription drug abuse. And prescription drug abuse, we see that a lot in teenagers when they take medication that's not theirs because they have easy access to get it from their parents or their friends or people in school. So yeah, even when not prescribed a certain medication, people, even not just teens, but people still find an easy way to get that medication to take it. In the article by Pharmacy Checker, they explained how from 1999 to 2006, the ages ranging from 12 to 17, the amount of taking medication that was not prescribed to them increased about 60%. So 60% of people ranging from 12 to 17 were taking medication that was not theirs. But to stop this, there have been a various amount of sites and organizations made specifically for this reason to help stop and prevent prescription drug abuse. The last thing I would like to discuss is Medicare. So Medicare is for those who are 65 years and up. And Medicare is a very important thing to have. According to the journal, American Journal of Health System Pharmacy, they provide some changes that should be made to Medicare. And these are just a few things that they provided. Such as increasing the need for patient assistance programs and also reduction in the reimbursement of medication errors. Understanding these rules can not only help the pharmacists, but can also help the patients who are receiving Medicare. So basically, to wrap this up, having guidelines in the pharmaceutical field are very important, and they help make sure medications are done correctly and that they're ready to ship out and give to people. And there are a lot of rules regarding to pharmacies, but they are there for a specific reason, and this is to make sure medications are being made properly and are being used properly. Thank you.